and we're concerned about our officers, the families. It affects our whole community.
Homicides like today's in Muskogee and this past weekend in Sand Springs really can leave their mark on first responders. 2 Works for You's Katie Kelleher shares how these events can affect their mental health and what they can do to work through all of this. Katie?
Thanks, Karen. First responders are no strangers to heartbreaking scenes, but that doesn't make them immune to them.
For a lot of these cops, this is, probably the worst thing they're going to see in their entire career.
A day at the office can mean a lot of trauma for first responders, never knowing what they'll see. And scenes like last weekend's in Sand Springs and Tuesdays in Muskogee have an impact.
Those of us that are police officers or the firemen or the paramedics that are having to go out to these calls, we're parents as well.
When they do show up to a scene, they know they have a job to do.
Sometimes the problem I know for me is you're working so hard, you're kind of on autopilot. You're not really stopping and processing, what you're seeing.
Jim Waring is a retired police sergeant who now works with other police departments, bringing mental health resources to officers. Waring says it's important first responders have a chance to talk to someone after a critical incident.
The quicker that they at least, unpack or process, the more likely they are to stay on duty, productive,
For Lieutenant Sean Larkin with Tulsa Police, he says, along with counseling, finding hobbies outside of work is important for the mental health of police officers.
If I know something our department encourages is for people to have outlets outside of this work. I love being a cop. It's been an excellent career for me personally, but it's not my identity.
Both men say after days like today, many first responders are going to go home tonight and hug their families. Katie Kelleher, 2 Works for You.